I'm going to start by introducing myself. I'm Shirley Joseph. My background is a nurse who has a varied experience in nursing in India and then moving on to Australia and then to the UK. I'm one of the international nurses who actually was recruited to the UK. So it's been a really large learning curve for me. And for me, it was about that culture change, that new learning, that new experience, and I've moved on, and it's been really fantastic. Some places have been not so good, some places have been fantastic and really great. Now I work as the care home quality lead for East Berkshire CCG. I'm basically, my main job remit looks around supporting care homes with innovative projects, some of the good practice, also helping them and assisting them in their CQC inspections if they require. Some of them do very well, some of them don't require my help, some of them do require my help. Today I'm going to talk about the importance of working as a system. So basically looking at integration, collaboration and partnership, and why it's important that we work together. Otherwise we will just be in a little corner and not being able to know that change is out there which is happening. So my biggest thing is engagement. If we don't engage with our partners across everywhere. I mean, I've particularly used my East Berkshire CCG stuff, so that could be anybody. It could be any of your local authority, it could be anybody from there. But these are some of the people who are involved, and it seems a lot. And if you see the middle, I've talked about integrated systems. So if I don't work with my community geriatrician, or if I don't work with my general practitioner, it's not going to be a very nice place out there for me, because I have to provide that quality care for my resident. Again, patient-centered approach. I think we've talked about it enough, and we can't stress that enough again. And with that patient care approach, we have to keep patient in center, where we're looking to plan for that patient, take time for that patient or resident, and that transformation resource which is out there. Here again, I'll talk about some of the things about articulating the vision, what we are able to do, because we have to be at the right scale. If you're not at the right scale, we're not going to achieve what we want, and we have to be really pragmatic about what we want to achieve in the care home. You could have things like just a very simple thing would be looking at the menu of the residents around. There was this care home who was going through a big transformational change, and they had a varied menu through the week where they had Asian and more South Asian kind of a menu, and the appetite was not very great because they didn't like those menus. So there was a survey was done, and it was analysed, and it was found out by the care home manager that they actually like the traditional English meals, which was could be from shepherd pie, then roast dinner, mashed potato, and mince, etc., toad in the hole, yeah, things like that. And once that got changed, and also providing a varied variety of what is out there, it increased the appetite for the patients, and they also enjoyed their meal, and there was more engagement at meal times. So it's about having that clear state of vision. What exactly do we want? We also sometimes, when working integration and as a provider and a commissioner, the commissioner tends to forget or probably does not bring that value of what the provider wants. So looking at what the provider actually needs. For me, as a commissioner, my care homes are my providers. So I would want to know what my provider would actually like. So let's say, talk about training. They have high turnover of staff. So that consistent training across that staff member, so that their quality is maintained, their service is maintained. So providing, rather than me thinking of, okay, fine, we'll do this training, but they already have that training in that, or let's talk about something else which is not even relevant to them, and they already are aware and have good experience on that. So it's talking about that. Also bringing that change. Change is not about something that is just bought in. It's about that sustainability across and keeping that change for success and a good outcome. some of the healthcare quality strategy reflects what people expect: caring and compassionate staff, clear communication, effective collaboration, a clean and safe care environment, continuity of care, clinical excellence. This is something which I think we all expect. If my dad or my mum was in a care home, I would expect most of that. And also from a commissioner point of view, if I had to go out to see that care home or probably spend a day there, I would expect things like that. Continuity of care kind of sits very high with me. Clinical excellence is another thing that sits quite high with me, which is because of my background, I guess. But for you, it might be that effective collaboration, that communication, that care. It just depends on where you're coming from, and that's quite important. This is where we were talking about why integration, collaboration and partnership is so important. There's something called silo working, where there's organizational barriers, different operational practices, duplication. And on the other hand, if you look up, you're looking at better access to services, local provision, prevent and delay in care needs. So if you're working silo, you have no idea what's happening there. You're just so stuck with your own culture, and you're not actually opening up for that change. And if you're not open for that change, I personally feel you're not going to do anything for yourself, and you'll be still there where you are even 20 years or 30 years from now on. However, if you look at working with other partners, you will have better access to service. You'll know out there what's important, what's not important, what works for me. And in connection to CQC really actually appreciate that well-ledness and also the innovation. What out of the way you've gone and done. So what's the extra mile you've done for your residents? What's the quality improvement project you've done? And how have you embraced technology? From a commissioner point of view, we've got something called EHCH, which is the Enhanced Healthcare, Enhanced Health, Care Home. Care homes. It's enhanced health for care homes. So where we've got about 7 different elements which looks at from collaborative working to technology to care, and also some innovative projects looking at especially at end-of-life care and dementia care. So can I say your care home?
You can say me.
Okay.
Me.
Patricia has involved with us on a collaborative working on the technology innovation, where they've actually gone in for the nhs.net email access, which is actually where you can share identifiable data with the hospital, with general practice and other communities which are part of health and social care. So they have a secure email and they're able to share that. And they've had a number of benefits with that, where one of their patients came back from hospital, they were able to share their discharge letter, something was missing, they were able to communicate with general practice, etc., etc. So the outcome has been so good, and they were actually able to share that with us quite a lot, and it was improving their quality rather than toing and froing with the general practice or with secondary care. What do we mean by integration, collaboration and partnership? I think I've talked about it a lot, but just probably summarizing, integration is a combined set of method, process and model that seek to bring about improved coordination of care. This is very NHS language, and you'll have to pardon me on that, but that's where I come from. And what does collaboration mean? So public organizations working in partnership to ensure a focus on care and support the health and health-related needs with local populations. So it's about looking after who you're looking after. Partnerships, as I said, joint working arrangement where partners and otherwise independent bodies agree. How does independent bodies come in? I'm just going to give you an example. We're working on a project called Verification of Expected Death, and we're actually providing a train the trainer project or train the trainer program, where we're giving the competency rights for a carer to able to verify a death when somebody passes away or dies in a care home. And we were able to actually include the funeral directors and the coroners as part of our stakeholder, so that tomorrow when they come to pick up that passed away gentleman or lady, they're able to kind of understand that they have that communication that yes, this has been verified and they've been trained and they're competent, rather than thinking, oh, who told you to do this? Oh, you're not allowed to do this. So it was really interesting to go to their meeting and their perspective of how funeral directors think and how coroners think. I mean, the coroners just turned around and said, oh, it's an expected death, so I don't need to be involved. I said, I totally get that. However, I'm informing you, I'm communicating that this is what we're doing. So they became part of my stakeholder, and that's what I call about independent bodies. Then agreeing to cooperate and achieve a common goal. So tomorrow when they actually are in part of the operational system, there is no toing and froing and the waste of time, and you kind of reduce those risks and actually provide a quality care. Some of the examples, I've already talked about it, but it's just leading on to that. I'm not going to read through, but when you get the slides, if you've got any questions, you can ask. Good practice, staff governance standard into practice in that we all the time do. Governance is very, very important, and we have to keep our staff members embraced on it all the time, and it's really, really important. And with GDPR in, I think we have to be more robust in everything we do, from starting with even talking about the resident when we're outside work, or even sharing small details when we're on the phone. Ensuring that everyone is clear about the values and the expected behavior. Empowering teams is so, so important. Employing people who actually have very good core values, and that values are actually reflecting and translating to what you believe in and what the company believes in. And also looking at management skills and competencies, having the right managers to lead with those skills. Culture. Again, creating that culture to learn. And if there is an error or a mistake, you know what, let's be transparent and embrace that mistake and say, what better could we do, or what better can we do next time? And what have we learned out of it? Yesterday, I'd just been to one of the care homes, and the manager was saying that the CQC picked up on how they were not able to transcribe why a particular medication was not given to X amount of residents. And when they reflected on it, they actually said that they did not provide that evidence. So if they had written on the back of the page that the patient actually said, I do not want it and has mental capacity, it would have been so much better for that CQC inspector to look at, rather than saying, oh my God, there's an error. You haven't given that patient that medication. So it's like that. So it's about, what for them it was about documentation and recording as a general thing. So now they're actually getting that training into the home, so that they're able to do that. Yeah. So things, and value the on-the-job learning. So if you're able to provide training, empower that carer or staff member, it's really, really good. And actually it helps the home as well. Some of the challenging contexts is complexity of some of the cases we deal with. The culture change is so important. It takes time. And change is something that happens. So it's like a strategic goal. So it's over time. It doesn't happen within 2 days or 3 days. It takes a good time frame, and you can have a time scale for it. High levels of public expectation and interest. So as you bring that culture change, people will expect more, because they'll be like, oh wow, you've gone on to an electronic sign-in. Oh wow, you've got a TV on there which gives us things. And it'll be more and more. Or what will our residents be able to have, etc., etc. Then some of the demographics, it's looking at internal and external stuff. Public value. So again, if you become outstanding, you kind of advertise that. Then collaborative working across traditional boundaries. Social care is another one. They have very traditional boundaries, and so does health. And health and social care sometimes clash a lot. And that's where I think some of the discrepancies and the difficulties happen. And it becomes hard. But I guess if we meet halfway and kind of think, okay, fine, these are your values, these are my values, where do we meet halfway and start to work collaboratively? It's quite difficult. I find it sometimes quite difficult to work with social care. And you're like, no, this doesn't work like that. And I'm like, no, it does work like this. So it's like, okay, fine, let me look at their detail to see what's happening. Co-production, diversity and equality is another big one. We have to respect that, and it's huge, it's changing. We have to keep ourselves updated with that diversity that's happening, and also respecting that diversity. And I mean, I have some very strong values about diversity and equality, but I'm in a culture, or probably I'm in an environment where I need to respect that, and I should be able to pass that on to my teammates and say, yeah, great, I respect your values, you're my values, but at the same time that change is happening and I should embrace that change.
Can I just say something about diversity and equality? For those who don't know, CQC has produced a document called Equally Outstanding. Use that document because it talks about
Is it called, sorry?
Equally Outstanding. It's a downloadable document. It encompasses human rights and the Equality Act, because it talks about LGBT and a lot of diverse gender differentiation, but how within the organization you are, how this is embraced. And there's a lot of information in there. Look at that, but also look at Quality Matters. It's another document from CQC. It's the recent one, yeah?
Yeah.
Look at the
I've
recent
got that.
one, 2017-18,
Yeah.
Quality Matters. Another great. Look at the easy one, print it, put it in front of in your lobby, but make your staff aware, you know, this is a document that you shouldn't be discriminating, because when, in that tips I gave you, there's the element about Sophie, the observational tool. They pick on that. For example, they will look into, are you discriminating resident X against resident Y? Are you discriminating staff X against staff Y? They look at that and they have elements that they look. So download the document and make it, again, some sort of guidance in your practices.
I'd like to stress again on the same equality and diversity is about the older generation are quite strict with what they believe, which is absolutely fantastic, and we respect that. However, as the new generation comes across, and some of our carers are very, very young, they have a different thought to it, and the residents may not accept what the culture is or what their gender is. However, it's about us to make that arrangement and that leeway for both parties to make it comfortable, because it can get very difficult. I know a care manager who was actually a gay, and I hope I can use that word.
A gay. Maybe just
Gay. Them, yeah. Them. So, and it when he did explain to the resident that yes, this is who I am, they didn't want to communicate with the manager. However, the manager said, yes, this is what I am, and I am and it's up to you if you want to accept that or not, but that's what I am. So it took a long time, and some people it doesn't matter, but some people it does matter, especially the older generation. It makes a huge difference. I need to keep that in mind and be really sensitive about these things. So I've just quoted Barack Obama, where change will not happen if we wait for some other person or some other time. We are the one we've been waiting for. We are the change that we seek. Okay, and it's all about what you can do as a person out there.
Thank you, Shirley.
Thank you so much. Thank you.